Peptic ulcer. Peptic ulcer is a very common disorder affecting the gastrointestinal tract. It is a disorder which have been highly attributed to lifestyle and stress. Let's learn about it in a little bit more details. Peptic ulcer is defined as a breakdown in the mucosal lining of the GI tract, which can occur anywhere in the gastrointestinal tract but usually involves the stomach and the duodenum. As you may already know, the GI tract is made up of 4 layers: the serosa outside, muscularis in between, submucosa after the muscularis, and then there is mucosa. Mucosal lining protects the stomach from the effect of acid. A break in this lining basically means that the stomach's acid will start digesting its own tissue. This whole mechanism of formation of ulcer, we will discuss it later. Let's first look at the causes of peptic ulcer. The most commonest cause of peptic ulcer is H. pylori infection, a bacteria that is usually passed from person to person and attacks the stomach lining. Did you know that in 2005, Dr. Barry Marshall and Dr. Robin Warren were awarded the Nobel Prize in Physiology for their work on proving that Helicobacter pylori was the cause of peptic ulcer. Before their discovery, only spicy food and stress was associated with peptic ulcer, and nobody ever thought of treating it with antibiotics until these two scientists proved their theory. And this was not easy. Dr. Barry Marshall actually had failed to demonstrate H. pylori infection in animals, and since nobody believed him, he decided to take matters in his own hands. He drank a concoction of H. pylori infection. Soon enough, he developed the infection, which led to gastritis and later ulcers in the stomach lining. But that's not all. He already knew that antibiotics will cure this infection and help treat peptic ulcer. So it wasn't just a discovery of the problem but also the solution. Thus, he proved that the real cause of peptic ulcer was an infectious agent named Helicobacter pylori. Now, there are also other causes that have been associated with this disorder, like prolonged use of NSAIDs, corticosteroids, or antiplatelet drugs. Excessive intake of coffee, tea, and alcohol all stimulate secretion of gastric acid. And well, some alcohol have a burning kind of effect onto the stomach lining. Prolonged stress, which not only stimulates excessive secretions of acid for a long time, but also reduces blood supply to the stomach, which slows down repair processes. Curling ulcer is also a type of gastric ulcer which occurs after major physical injuries, especially after burns, due to severe stress and decreased blood flow to the stomach's lining. Another ulcer, called as the Cushing's ulcer, is a type of gastroduodenal ulcer which also occurs as a result of increased intracranial pressure. The mechanism of both Cushing's and Curling's ulcer will be discussed in another video. Now let's talk about the pathophysiology of this disease. So as discussed earlier, what happens is due to any etiological factor or causative factors, there is excessive secretion of hydrochloric acid in stomach. And also there is decreased production of mucus in the stomach. Since there is less mucus and more acid, the acid is able to eat up the mucus and attack the mucosal lining. Once it comes in contact with the mucosal lining or covering is broken and the stomach layers are exposed to acid. The acid, which is capable of digesting meat and food, practically ends up burning or digesting the gastric mucosa. Thus, the layer forms a small wound or ulcer. With continuous exposure to acid, the ulcer will keep on expanding till it penetrates all the remaining layers of the stomach, so much so as to cause a hole in the stomach. Most of the times though, the ulcer may heal before it could expand due to the protective mechanisms of the stomach. Thus, sometimes simple lifestyle changes may help in preventing the formation of an ulcer, as these changes facilitates healing. Now there are two main anatomical types of ulcers, namely gastric ulcer and duodenal ulcer. Gastric ulcers are ulcers that form in the stomach, while the duodenal ulcers form in the first part of the small intestine. The pathology remains the same, though their symptoms are different from each other. So just briefly, let's discuss general differences between them. Besides pain, some other clinical manifestations includes bloating, vomiting, anorexia, weight loss, discomfort, heartburn, nausea, and blood in stool. Coming to diagnostic test, a blood test may be used to determine the presence of H. pylori infection. Stool antigen test is done to determine presence of H. pylori in the feces. Barium swallow X-ray, a procedure in which the patient drinks barium so that it coats the lining of the GI tract, is also done to locate and visualize the ulcer clearly. Endoscopy, a procedure in which a tube is passed into the GI tract with a camera to visualize the ulcer and also to take a biopsy sample of the tissue, which may be performed. The urea breath test is often considered as the gold standard test in the diagnosis of H. pylori infection. H. pylori produces an enzyme called urease, which breaks down urea into ammonia and carbon dioxide. A urea tablet is given to the patient in this test to be swallowed, and the amount of exhaled carbon dioxide is measured. This indicates presence of H. pylori in the stomach. Coming to its treatment, the medical management of the disease, it is commonly treated with antacids, which helps to neutralize the stomach's acid. A proton pump inhibitor may be used to reduce the HCl secretion as it blocks the pathway of acid secretion in the stomach. H2 receptor blockers also reduces the secretion of HCl and chemical mediators that stimulates inflammation. And obviously, antibiotics are also used to kill the H. pylori infections and prevent further progress of the disease. In surgical management, vagotomy, a procedure in which the vagus nerve is cut, is done. Vagus nerve stimulates HCl secretion, and when its stomach supply is broken, it cannot stimulate HCl secretion, thus improving patient's condition and preventing recurrence of the problem. Now, when the ulcers are actually big and severe and non-healing, gastroduodenotomy is performed. There are two types of gastroduodenotomy. One in which the lower part of the stomach is removed and then the remaining part of the stomach is joined to the duodenum. This procedure is called as Billroth 1. In Billroth 2, only the antrum of the stomach is removed and the remaining part of the stomach is joined to the duodenum. Lastly, let's talk about the lifestyle modifications. Lifestyle modifications can help heal as well as prevent peptic ulcer disease and are important part of managing peptic ulcer. In dietary modifications, avoid spicy and fatty food as they stimulate excessive secretion of HCl. Avoiding or reducing soda, alcohol or caffeine can help in reducing gastric acid secretion, thus preventing formation of ulcers. Reducing alcohol can go a long way in your overall health too. Also, quit smoking as nicotine is a gastric acid stimulant. Add fruits and vegetables to your diet as well as stay hydrated. Both of this not only helps balance and protect your GI tract but also helps in overall gut health. Avoid over-the-counter medications, especially NSAIDs, which are known to cause peptic ulcers. Reduce stress and sleep well, which will reduce unnecessary stimulation of the gastrointestinal tract and acid secretion. So this was all in peptic ulcer disease. Hope to see you well and hope this lecture was useful. For queries, please comment in the comment section. Please do support the channel for more such content by clicking the like, share and subscribe button. And until next time, see you soon.